Warning, nothing in this video should be taken as medical advice. If you believe going to a random person on YouTube for your medical advice is wise, please consult your nearest mental health care professional.
Hi, I'm Heath Morrison. Welcome to Health Summit.
Placeholder audio. This audio is for a placeholder.
We'll work on that. So this is my first crack at a video, and I thought I'd kick things off by telling you a story that kind of gives you an idea of why I'm making videos in the first place. We'll do a full intro later, but the short version is I'm just a random guy who got really annoyed with the way the healthcare system works in the United States, particularly the billing system. So, without further ado, I present to you the story of Alex. He's shy. He's my roommate, and you couldn't ask for a better one. He's a laid-back guy who's finishing his degree and hoping to move up to Oregon soon. He plays guitar, composes music, and wrecks all the noobs on Call of Duty.
Oh, why? Why are you so bad?
I don't know, I'm doing really terrible.
He's just a great guy. He even wrote me my own theme song. That's an original work, right? Anyway, as great as Alex is, he's not perfect, and he developed some severe scoliosis as a kid, which required some major surgery when he was a teenager. So as you can probably guess, he's more used to aches and pains than most of us have to deal with. But recently he had some severe neck pain that kind of moved into his shoulder, so he decided to go see his GP about it. He told his doc about the pain, and since Alex has had that crazy intense back surgery, his GP suggested he go see a specialist called an orthopedist. Alex trusts his doc, so he says sure, and goes to the specialist the GP recommends. And here's where things start going off the rails. So Alex goes to this orthopedic specialist, and it turns out that it's a husband and wife team. Isn't that sweet? So first the wife sees him for about 10 minutes. She goes over his medical history and asks for any background, and then she leaves the room for about 15 minutes. Alex waits there patiently, and soon both she and her husband arrive in the room. Her husband then spends about 5 minutes with Alex, taking him through some basic range of motion tests, and then suggests that Alex get an MRI. He even helpfully suggests a place where Alex can get the MRI done. Easy peasy, right? I mean, it's a little quick for an appointment, but you like efficiency, right? You want to get out of there, yeah? Yeah? No. 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 So, a couple of things to unpack here. First, why did both doctors see Alex? I mean, aren't we always told that doctors don't have any time anymore and that family practices have to use their resources as efficiently as possible? Is this just a really progressive clinic where a second opinion is just baked right in? Yeah, no. Turns out when we looked online, the wife in this lovely husband and wife team is a GP, and her husband is the orthopedic specialist. Didn't Alex already see a GP? Isn't that who referred him to the specialist in the first place? Yeah, he did. He saw a GP already. So why would the orthopedic specialist who received a referral from a GP put Alex into a room with another GP? Well, it has to do with complex medical codes and procedures doctors have to go through to charge insurance companies, which we'll have to cover in a whole nother video. Probably a series of videos. But basically, if a doctor takes down a complex medical history, they can justify charging more. Even if they already have your complete history from the referring doctor, they can charge you and your insurance company more if they take a complete history in the appointment. So why would the GP take that history when Alex came to see the orthopedic specialist? Well, we can't say for sure, but a quick look at this chart might give you an idea. See, an orthopedic specialist can charge a ton more for his or her time than an internist can charge. So if you have the cheaper internist take the first part of the appointment and then tag team in the specialist doesn't have to spend time understanding what's actually wrong with the patient and can go spend more time on higher cost procedures. Isn't learning fun? Ah, but wait, there's more. Remember what I said?
Her husband then spends about 5 minutes with Alex, taking him through some basic range of motion tests, and then suggests that Alex get an MRI. He even helpfully suggests a place where Alex can get the MRI done.
No. We could go into the fact that this guy just made a $2,600 recommendation based on 5 minutes with his patient, but instead, let's focus on this handy lab that he just happens to know where Alex can get his MRI. Turns out this particular doctor just happens to know about this lab because he just happens to be a managing physician at it. So he gets a direct financial gain for every referral he makes. So no conflict of interest there. Let's say you're on a first date with somebody and you're getting along pretty well. And then they say, hey, I know a great place to get a drink. But what they mean is the minibar in their motel room. You get a little creeped out. That's the same kind of feeling I get whenever anyone makes an impartial recommendation that directly impacts their wallets. Even when doctors do it. Actually, especially when doctors do it. One last little detail that shows you that this doctor really had Alex's best interests at heart relates to Alex's insurance. Now, Alex is on an HMO, not exactly the most flexible type of insurance plan. Can you guess what the doctor failed to check before he referred Alex to his very special lab? I'll give you a second to think. It's B! No, it was actually C. Turns out that this lab isn't covered by Alex's insurance at all. Odd that the doctor would make the referral without first checking if Alex's insurance would cover it. Almost as if he didn't care whether it was Alex who was on the hook for the entire $2,600 that these scans average. Even more odd because there are plenty of facilities that would take Alex's insurance. Very strange that he would make that referral. Very, very odd indeed. Now I know many of you are saying, but Heath, it's Alex's responsibility to make sure that his insurance covers any scan he decides to undergo. And you are absolutely right. Except, are you? The thing is, we tend to put doctors into a different category in this country. The thinking tends to go, my doctor's job is to take care of me, so she wouldn't rip me off. Ripping me off isn't taking care of me. Unfortunately, that's a little like saying, my auto mechanic's job is to take care of my car, so he wouldn't rip me off. Ripping me off isn't taking care of my car. Of course your doctor probably wants to fix you, just like your auto mechanic probably wants to fix your car. But they're both still motivated by money. The difference is, most people don't implicitly trust every auto mechanic they happen to run across. Or at least they shouldn't. Those in the medical profession know about this trust. And sometimes, consciously or otherwise, they abuse this trust by not considering the financial impact on their patients. Even when doing so wouldn't reduce the quality of care. Alex can get an MRI anywhere. And the same goes for loads of procedures where cost can and should be a big factor in the decision making. Sometimes care costs more for a good reason. And sometimes it just costs more because we do what we're told by people we trust. So, what have we learned today? First, always ask questions. Why am I seeing two doctors? Always know who you're seeing and why. Am I seeing the specialist or another GP for no reason? Always understand motivations. Does my doctor have a financial interest in sending me to a specific lab, facility, or surgical center? And 4, always check whether a facility is in your insurance network. Just because this doctor is in my network doesn't mean the facility he's sending me to is. There is a lot of other stuff we could talk about in just this scenario alone, from a doctor spending 5 minutes to determine a course of action, to the hoops doctors have to jump through to get insurance companies to pay at a certain level. But we're going to have to cover it at a different time. I'm way over budget right now. Okay, we're done. All good. Great. Never ended a video before. Bye.